Welcome back, everyone, to the deep dive. It's time for another deep dive with our Sam P. Most MD series.
Where we take one of the great research papers that he and his colleagues have published.
Exactly. And we kind of dig into it. We take a little bit of a deeper look at some of the fascinating research coming out of Dr. Moat's lab.
And this one is particularly fascinating.
What you're telling me.
Yeah.
So today we're diving into the world of rhinoplasty.
Nose jobs, for those of us who don't speak medicalese.
Nose jobs, exactly, but with a twist.
Always got to have a twist.
Always got to have a twist, right?
Totally.
So we're looking at whether a common acne medication, isotretinoin, can actually improve the outcome of those nose jobs,
Rhinoplasty.
especially for folks out there with thicker skin.
Yes, that was my reaction exactly.
It has the same reaction.
When I first saw this topic, I was
Yeah.
like, acne meds and nose jobs?
No.
That's interesting. Tell me more.
Yeah, so tell me more. Okay, so walk me through this. Most people probably think of isotretinoin as like Accutane, right?
Yeah.
The acne treatment. How could that possibly relate to a nose job?
Well, it's a powerful drug derived from vitamin A, and it works by shrinking those oil glands in your skin.
Right.
That's how it fights acne. But it also has an interesting side effect of
Oh.
thinning the skin.
So the idea is that if you thin the skin on the nose before surgery, it might be easier for the surgeon to kind of sculpt and refine the shape.
Yeah, so you've got thicker skin.
Yeah.
Thicker skin can be a real challenge in rhinoplasty
Really?
because it can make it difficult for surgeons to see the underlying cartilage framework clearly,
I see.
which impacts their ability to create, a really precise and refined result.
I could see how that would be a problem.
Yeah.
So less bulk to work with.
Yeah.
Potentially better results, especially for patients with naturally thicker skin.
Exactly. And that's what Dr. Most and his team wanted to investigate.
Okay.
Does using isotretinoin before rhinoplasty actually lead to better outcomes? So they conducted a systematic review in 2025 to find out.
A systematic review that's pretty thorough, right? That's not just looking at one study, that's looking at a whole bunch of research on the topic.
Absolutely. They searched multiple databases focusing on original research studies on adults who underwent rhinoplasty and used isotretinoin preoperatively.
Okay.
And, case reports and small studies were excluded
Got it.
to make sure they were looking at the most robust data available.
Okay, so drum roll, please.
Yeah.
What did they find?
Yeah.
Was there a ton of research supporting this idea?
Well, that's where things get interesting.
Oh.
They only found 6 studies that fit their criteria.
Only 6.
Yeah.
Wow, that's really eye-opening. It suggests that this whole idea of using isotretinoin in rhinoplasty is still relatively unexplored territory.
It really is. And of those 6 studies,
Yeah.
3 were retrospective, meaning they look back at past cases,
Okay.
and 3 were randomized controlled trials, the gold standard RCTs.
RCTs, those are the ones where you have like a treatment group and a placebo group to see if the treatment makes a real difference.
You know your research lingo.
A little bit.
And importantly, 2 of the RCTs had a good quality rating.
Okay.
So their methodology was strong, which gives their findings more weight.
Okay, so eye on the edge of my seat here.
Mm-hmm.
Did the isotretinoin actually work? Did it improve rhinoplasty outcomes?
Here's where the results get a little tricky.
Okay.
It's not a clear-cut yes or no.
Uh-oh.
So while 4 studies reported that patients were more satisfied with their appearance after surgery,
Okay.
only 2 followed them for a full year,
Okay.
and neither of those had a control group.
Hold on. So we don't know if the improvement they saw was really from the isotretinoin or just the natural healing process after rhinoplasty.
Exactly. It's possible those patients would have been just as happy with their results even without the medication.
Right.
That's the problem with not having that placebo group for comparison.
Ah, that's frustrating.
Yeah.
It feels like we're getting close to an answer, but we're not quite there yet.
Yeah.
I know, right? It's a good reminder that science is a process,
Yeah.
We have some intriguing clues,
Yeah.
but we need more research,
Yeah.
especially those long-term studies with control groups to really understand if isotretinoin is the game changer some hope it to be.
So we're left with more questions than answers right now.
Mm-hmm.
Let's unpack these 6 studies a little bit more.
Sure.
I'm really curious about how they actually used the isotretinoin. Like, did all the patients take it for the same amount of time? Did they start taking it weeks before surgery or right before?
That's a key point, and it actually highlights one of the big challenges with this review.
Okay.
The treatment protocols were all over the map.
Really?
Some patients started isotretinoin weeks or even months before their surgery, while others began taking it much closer to their procedure.
Mm.
The dosages and how long they took it varied quite a bit, too.
So it wasn't like a standardized, isotretinoin for rhinoplasty regimen. That makes it tough to compare the results, doesn't it? It does, yeah. It's like trying to compare apples to oranges.
Right.
It makes you wonder if there was a standardized protocol,
Yeah.
Would we see more consistent and convincing results?
Right.
It's definitely something future research should look into.
Okay, so different protocols, harder to draw conclusions.
Mm-hmm.
What about how they measured the results? Did they all look at the same things?
Well, that's another area where things get a little messy.
Okay.
Some studies focused on patient satisfaction surveys, asking people
Right.
how happy they were with the appearance of their nose after surgery.
That makes sense, but it seems a little subjective, doesn't it?
Mm-hmm.
Someone's happiness with their new nose could depend on a lot of things.
Right.
Not just the medication.
Exactly. And that's why some studies also used more objective measures like imaging techniques to actually measure changes in skin thickness.
Okay, so some looked at how people felt about the results,
Mm-hmm.
and others looked at actual physical changes.
Yeah.
What about those 2 high-quality RCTs we talked about?
Yes.
What did they find?
Yeah, the first one done in Iran focused on postoperative edema,
Edema.
which is just a fancy word for swelling.
Swelling.
They found that patients who took isotretinoin before surgery had much less swelling
Okay.
at 3 and 6 months
Okay.
compared to the placebo group.
So less swelling.
Yeah.
That's a big deal for anyone who's had surgery.
Yeah.
Recovering with less swelling would definitely be a welcome improvement.
I agree. It's promising.
Yeah.
But keep in mind, they only followed patients for a year.
Oh, okay.
We don't know if those benefits lasted beyond that.
Good point. Okay.
Yeah.
What about that other high-quality RCT?
The researchers in that one, conducted in Brazil,
Okay.
used ultrasound to measure skin thickness before and after surgery.
So they were looking at measurable physical changes in the skin itself.
Exactly.
And
And what they found was really interesting. The patients who took isotretinoin had a noticeable decrease in skin thickness at 6 months, particularly on the bridge and tip of the nose.
okay.
And that reduction wasn't seen in the placebo group.
Wow. So in that study, the isotretinoin really did seem to thin the skin.
Uh-huh.
This is getting me excited.
I understand your enthusiasm.
Yeah.
But hold your horses. It's just one study.
Yeah.
And we need more research to back it up.
Right.
Plus, as we talked about earlier, isotretinoin does come with risks.
Of course.
And that's something you have to factor in.
Okay. I hear you not getting ahead of ourselves.
Yeah.
So where does this leave us?
Right.
What's the takeaway from all this research on isotretinoin and rhinoplasty?
I think it's safe to say the idea has merit.
Okay.
And deserves more attention.
Yeah.
We have some hints that isotretinoin could improve certain aspects of the procedure,
Yeah.
like reducing swelling and thinning the skin.
Okay.
But the evidence is still pretty limited.
So more research is needed,
Yes.
especially those large, well-designed RCTs.
Yes.
And longer follow-up periods
Uh-huh.
to really understand the long-term effects, both good and bad.
You nailed it. This is just the tip of the iceberg.
Wow.
We still got a lot to learn.
All right, so it's not a simple answer.
Right.
But that's often how science works, right?
Exactly.
We have a lot to consider,
Mm-hmm.
both in terms of potential benefits and risks.
Exactly. And speaking of those risks, let's shift gears and delve into the side effects of isotretinoin in a bit more detail.
All right, so we've been talking about the potential benefits,
Yeah.
of using isotretinoin before rhinoplasty. But
Right.
as you mentioned, there's another side to this coin,
Yes.
the downsides,
A potential downside.
the risks, right? Isotretinoin isn't exactly known for being a gentle drug.
You're absolutely right. It is a powerful medication.
Yeah.
And it's not without its risks,
Yeah.
Dry skin, lips, eyes, even inside the nose.
Right.
Those are some of the most common complaints.
Yeah. And we've touched on some of the more serious potential side effects, right? Like liver problems and mood changes.
Mm-hmm.
It sounds like it's not something you'd want to take lightly.
Yeah.
Without a good reason and close monitoring by a doctor.
Exactly. And even though the studies in the review mainly reported mild side effects,
Okay.
there were a few cases of more serious complications, like that skin necrosis we mentioned.
Right.
Yeah. So it's a stark reminder that this medication needs to be taken seriously.
Yeah.
Patient safety is paramount.
Yeah.
Careful selection and monitoring are crucial.
Absolutely. It's a delicate balance, isn't it?
It is.
Weighing the potential benefits
Yeah.
against those very real risks.
Yeah.
So what are the big unanswered questions?
Right.
What kind of research do we need to see
Mm-hmm.
to get a clear picture of how isotretinoin might fit into the world of rhinoplasty?
I think, more is always better when it comes to research. We
Right.
need more of those large, well-designed, randomized controlled trials, the RCTs, to really understand cause and effect.
Uh-huh.
And long-term follow-up is critical. We need to know if those improvements in swelling and skin thickness last
Right.
and what the long-term safety profile looks like.
So basically, more studies with more people, longer follow-up, and ideally,
Yes,
a more standardized approach to how the isotretinoin is actually used.
you got a showing. A standardized protocol would allow for better comparisons across studies.
Yeah.
It would help us figure out the optimal dosage duration of treatment and timing.
Right.
Should people start taking it months in advance, weeks in advance, or maybe even right before surgery?
Yeah.
These are all questions that need to be investigated systematically.
This has been a fascinating deep dive.
Yes.
I came in wondering how an acne medication could possibly relate to nose jobs.
Right.
And now I'm seeing how it could be a game changer.
Yeah.
But we're just not there yet in terms of solid evidence.
I agree. It's a perfect example of how medicine is constantly evolving.
Right.
What we consider standard today could be totally different tomorrow.
Yeah. Yeah, that's what makes it so exciting.
Exactly.
There's always more to discover and learn.
And who knows, maybe one day we'll be talking about the isotretinoin protocol for rhinoplasty like it's the most normal thing in the world.
I love it.
But until then, more research is needed to figure out if the benefits outweigh those potential risks.
Well said. Seems like Dr. Mose and his team have opened up a fascinating new area of exploration in the world of rhinoplasty.
Definitely.
I, for one, am definitely eager to see what future research uncovers. Thanks for joining us on this deep dive into the research on isotretinoin and rhinoplasty. Be sure to check out the full systematic review if you want to explore further. And as always, stay tuned with the next installment of the Deep Dive.